Well, we've been talking about the mental health crisis among veterans for a while now, but one local veteran who works in the field says the pandemic is exposing civilians to some of the same emotional trauma that vets have been dealing with for years.
KCTV5's Betsy Webster joins us live now from the campus of the University of Kansas Health Systems. Betsy, what are these similarities?
Well, yeah, I want to be clear. You know, the combat, a war zone, there's really nothing about civilian life in the United States that compares quite to that. But a veteran who works with mental health patients, military and otherwise, here at the health system says there are some similarities, some common threads like isolation and fear of death. Barry Browning spent 31 years in the U.S. Army. Among other deployments, he was in Iraq in 2003, 2009, and 2010.
I was the Deputy Chief of Staff of Medical Plans and Operations for Iraq as we were starting to do the drawdown and exit.
He's now the Senior Administrator in Adult Psychiatry for the KU Health System. Some of the veterans' mental health issues come from violence they lived through. But that's not all, he says. With so many tours overseas, Browning missed a lot of his daughter's birthdays, dances, and more.
You're isolated. You're away from your family. You're away from your support system. And so people that non-military during COVID were doing the same things.
In the height of the pandemic, he saw that isolation play out with COVID patients who couldn't see family and vice versa.
How many times have you heard the story of a parent that was ill in the hospital and their kids tried to come see them, but they couldn't even get in the hospital to be with their parent as they were passing away? Well, that's traumatic.
Fear of death is something else that came with the territory in the military that crept into civilian life with COVID. He says the PTSD triggers are different, but
the effects of it, nightmares, sleeplessness, anger, isolation, all these things that can happen, and it can happen to anybody.
Now, if you notice any of those signs in someone you know, he says help them get help. There are a lot of programs out there, and even if it's not professional help, peer support can be useful too, just connecting them with other people who've had similar experiences. Reporting live, Betsy Webster, KCTV5 News.
Thanks, Betsy.